Good morning, everyone. I am going to call to order the Joint Subcommittee on Human Services. If we can take the roll.
Assemblywoman Anderson. Assemblywoman Dickman. Assemblyman Hafen. Assemblywoman Hardigy.
Here.
Assemblywoman Monroe Marino.
Here.
Assemblyman Watts.
Here.
Assemblyman Yeager.
Here.
Senator Canizaro. Senator Dondero Loop.
Here.
Senator Severs Gansert.
Here.
Senator Titus.
Here.
Assemblywoman Gorlow.
Here.
Chair Nguyen.
Here. And if we can mark those members present as they arrive, and we will just jump into these budget closings. We have budget closings, and then we will conclude with public comment. Today, we are closing the budgets from the Department of Health and Human Services, Aging and Disability Services Division. And if we can turn it over to staff to start that process.
Thank you, Madam Chair. For the record, Brody Lizer, LCB Fiscal. There's 10 of the division's budgets that'll be closed today. 6 of these were heard in the budget hearing on March 23rd, and 4 are staff close recommendations. The first budget is the administration budget. It begins on page 3 of your closing packet. There are 3 major closing issues. All are new position recommendations. The first issue is Governor recommends approximately $656,000 over the biennium to fund 5 new information technology positions and associated costs. This would include 1 IT technician 4, 2 IT professional 2s, 1 IT professional 3, and 1 IT manager 1. The position duties are listed there at the bottom of page 3 of your closing packet. The agency had indicated that its programs and business units have grown significantly over the last 10 years, and that ongoing IT support needs currently exceed the number of staff available. These new positions would enable IT staff to respond to and resolve backlogged work orders, allow for the completion of IT projects, including some core system modernizations planned over the next few years. The agency did indicate during the budget hearing that an analysis identified the actual need was about 30 additional IT positions, and so this request is only for 5 positions. The decision for the subcommittees on page 4 of the closing packet. Does the subcommittee wish to recommend approval of total funding of $655,705, including general fund appropriations of $131,141 over the 2023-25 biennium to fund 5 new information technology positions and associated costs as recommended by the governor?
Oh, man. I'd entertain a motion at this time.
So moved. Second.
Any further questions or discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. The second major closing issue is a recommendation for new human resource positions. The governor recommends approximately $407,000 over the biennium to fund 1 administrative assistant position, 1 personnel technician 3, 1 personnel analyst 1, and 1 personnel officer 2 position for the human resources function of the division. The position duties for the new positions are listed there at the bottom of page 4 of your closing packet. Similar to the IT positions that the subcommittee just recommended approval for, the division's programs and demands for services have grown significantly over the last 10 years. Associated staffing has nearly doubled in size. However, its human resource staff has not increased proportionately. The current staffing levels have resulted in delayed recruitments, inadequate response times, limited training for supervisors, and a lack of cross-training on critical tasks. During the budget hearing, the division did indicate that the new positions would help build career paths within the division to help retain staff among its human resources team, and provide for promotional opportunities along with increasing capacity among the division's human resource team. The decision point is on middle of page 5 of your closing packet. Does the subcommittee wish to recommend approval of total funding of $406,927, including general fund appropriations of $81,387 over the 2023 biennium to fund 4 new human resource positions and associated costs as recommended by the governor?
Do we have any questions or comments? Seeing none, I'd entertain a motion.
So moved. Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries.
Thank you, Madam Chair. The next major closing issue is on page 5 of the closing packet. The governor recommends approximately $172,000 over the biennium to fund a new administrative services officer position to support the division's central fiscal services. The division's workload has increased with the transfer of the Office of Consumer Health Assistance budget to the division, which occurred in 2021. And this position has a focus or need particularly to assist with activities associated with the home and community-based services budget. There is also one new budget that's recommended for inclusion in the division, and a recommendation to split out the existing home and community-based services budget from one budget into 4 budgets, which would increase the total budgets managed by the central fiscal staff from 8 budgets to 12 budgets. The position is needed to oversee ongoing budgets and allow for appropriate workload distribution among staff based on the level of complexity and time involved with each budget account that's managed by the division. The decision point is on page 6 of the closing packet. Does the subcommittee wish to recommend approval of total funding of $172,183, including general fund appropriations $34,436 over the 2023 to 25 biennium to fund a new administrative services officer position and associated costs as recommended by the governor?
Any questions? Seeing none, I'd entertain a motion.
So moved. Second.
Any further questions or discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries. Next item.
Thank you, Madam Chair. The next item is related to the Coronavirus State Fiscal Recovery Fund section on page 6 of your closing packet. In October of 2022, the Interim Finance Committee had approved $7.5 million in coronavirus state fiscal recovery funds to fund the modernization and integration of the division's case management data system. The governor's recommended budget includes approximately $1.9 million in each fiscal year to continue this project. Based on revised projections and information received through the governor's finance office, fiscal staff would recommend a technical adjustment to align funding in this budget for that particular project. The technical adjustment would result in $5.3 million of authority in fiscal '24 and $2.2 million in fiscal year 2025. Decision point on the bottom of page 6 of your closing packet. Does the subcommittee wish to recommend approval of Federal American Rescue Plan Act Coronavirus State Fiscal Recovery Funds of $5.3 million in fiscal year 2024 and $2.2 million in fiscal year 2025 to continue previously approved funding for the modernization and integration of the division's case management data systems, based upon updated information provided by the governor's finance office?
Thank you. Any questions or discussion? Seeing none, I'd entertain a motion.
So moved.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Let's move on to 30. Are we on 31? Nope. No, we have other closing items. Never mind. I jumped the gun. Go ahead.
Thank you, Madam Chair. The other, again, for the record, Brody Leiser, there's 9 other closing items listed on page 7. There's one technical adjustment under other closing item 8 to just align base budget to account for align expenditures and align budget authority associated with a management analyst position transfer. And other closing item 9 is a recommendation to increase the salary of an unclassified chief of elder rights attorney position from $99,797 to $107,676 to align the composition of that position with other attorney positions in state service. I would just note that the salary for that position will be considered when the pay bill is discussed and considered, as is all the salary for all unclassified positions. So the decision point is on the top of page 8. Fiscal staff recommends other closing items 1 through 7 and item 9 be closed as recommended by the governor, with the unclassified salary noted in other closing item 9 to be determined when the 2023 pay bill is considered, and other closing item 8 be closed with the noted technical adjustments and request authority to make other technical adjustments as necessary.
Questions? Seeing none, I'd entertain a motion.
So moved. Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries. Now we can move on to the next budget, 3156.
Thank you, Madam Chair. The next budget's the senior prescription and disability prescription budget. The governor recommends decreasing Healthy Nevada funds by, the first major closing issue is on page 9 of your closing packet. It has to do with caseload adjustments. The governor recommends decreasing Healthy Nevada funds by $7,280 over the biennium to fund projected caseload changes for the senior prescription disability prescription program. This program provides a subsidy of up to $37 per month to help offset the Medicare Part D prescription drug plan premium. The agency indicated during the budget hearing and provided information that the caseload has decreased, and the caseload is projected to continue to decline under the current model due to individuals qualifying for other programs and from members changing to Medicare Part D plans with $0 premiums. My understanding is that Medicare Part D plan has been expanded with regards to pharmaceutical assistance through federal funds, and as such, this program has seen a decline in its caseload. I would note that Senate Bill 4, which is currently in the Assembly Committee on Health and Human Services, would provide more flexibility and enable the division to adapt the assistance program to address the pharmaceutical needs of a broader population. And so if that bill does move forward, it may expand the population that's eligible for this subsidy. There's a table at the bottom of page 10 that includes the updated caseload projection information. So similar to other department budgets that the subcommittee has heard and that you'll hear today, we get updated caseload data in March 2023 using actual caseload data through February 2023. And so you can see in the table at the bottom of page 10 what those updated projections are, which reflect a caseload of 512 in fiscal year 24 and 516 in fiscal year 2025. The updated caseload decision units, which are the M200 and M201 decision units, result in a net reduction of just over $12,000 compared to the costs recommended in the executive budget, and would, as I mentioned, support a monthly caseload of 512 and 516 individuals in fiscal year 24 and 25 respectively. The funding is based on providing an average subsidy of $25.25. The decision point for the subcommittee is on page 11. And does the subcommittee wish to recommend approval of decreasing Healthy Nevada funds by $10,331 in fiscal year 2024, $9,336 in fiscal year 2025 to align the senior prescription disability prescription programs caseload with the March 2023 projections based on an average subsidy of $25.25 per month?
Any questions? Seeing none, I'd entertain a motion.
So moved. Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries. And we'll move on to number 2.
Thank you, Madam Chair. The second consideration for the subcommittee is the governor's recommended budget. Recommends the consolidation of the senior prescription and disability prescription program expenditure categories. The agency had indicated that the consolidation of these two expenditure categories would allow the agency more flexibility to meet the expenditure needs of the program. And so the decision point here at the bottom of page 11 of the closing packet is, does the subcommittee wish to recommend approval of the governor's recommendation to combine the senior prescription and disability prescription program expenditure categories into a single category?
Sorry, microphone troubles. Any questions? Seeing none, I entertain a motion.
So moved. Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries. And we are moving on.
All right.
Look at us moving. 3204.
Sorry, Madam Chair, just for the record, Brody Lizer.
Every time.
That's all right.
Just, okay, go ahead.
That's what we're here for. There's two other closing items in this budget. At top of page 12, fiscal staff would recommend that the other closing items be closed as recommended by the governor and request authority to make technical adjustments as necessary.
Can I go now? I'm so glad that they are here to keep us in line. Their efforts do not go unappreciated. At this time, do we have any questions regarding this? Seeing none, I'd entertain a motion.
So moved. Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries. Okay, now we can move on.
Thank you, Madam Chair. For the record, Brody Lizer. The next budget is the Consumer Health Assistance Budget. Begins on page 13 of the closing packet. The first major closing issue is a recommended funding source change. The governor's budget recommends additional general fund appropriations of approximately $449,000 over the biennium to replace multiple interdepartmental transfer revenue sources that were previously allocated to support a portion of ongoing personnel and associated operating costs. This would include offsetting revenue transferred from the Silver State Health Insurance Exchange, the Division of Public and Behavioral Health, Healthcare Facilities, and the Division of Public and Behavioral Health Prevention and Treatment budgets, and is revenue that will not be received due to a decreased workload and a decrease in associated billable activities. There is a table on page 14 of your closing packet that reflects the revenue approved in the current biennium for which the governor's recommendation is based on for the approximate $449,000 over the biennium. I would just note that NRS 232.458 provides that the costs of this office that have no available funding source must be provided by direct legislative appropriation from the general fund. And again, this recommendation to replace these funds is due to a decline or a shift away from billable activities that the agency can no longer recover these costs for through these transfers. However, I would note that while actual staff time has shifted from the billable activities, the Office of Consumer Health Assistance continues to provide consumers with the appropriate referrals for services, and would also note there was some discussion during the budget hearing that part of the shift in staff's time is attributable to the implementation of Assembly Bill 469 from the 2019 session. That bill prohibits a consumer from being balance billed under certain circumstances, and through subsequent regulations, the agency has designated employees of the Office of Consumer Health Assistance to conduct arbitration for medically necessary emergency service claims of less than $5,000. The office has indicated that approximately 20% of staff time is being attributed to these efforts, and that while staff would note that while NRS 439B.754 does provide a means for the agency to bill for the costs of certain arbitrator claims, NRS 353.249 requires all monies collected by the state to be deposited in the general fund unless a specific statute authorizes the agency to retain funds. So while the agency is currently billing and collecting revenues associated with arbitration services, they do not currently have statutory authority to retain those revenues in the budget. And so those revenues would otherwise revert to the general fund. As I mentioned, moving on to page 15, as I mentioned, the division has indicated that a substantial amount of staff time is being spent on these arbitration activities. And at this time, these revenue collections are new. This, I believe, is the first fiscal year in which these revenues have been collected in the budget. And so there's some volatility with this revenue source. While the agency had projected collecting just over $310,000 in fiscal year 2023, looking at revenue collections through the end of March, annualizing those amounts, fiscal staff calculates that to be about $182,000 per year, which may be a conservative estimate, but is, again, based on actual collections and annualizing those amounts through fiscal year 2023. So currently, absent a statutory change that would authorize the agency to retain the arbitration charge revenue to recover its costs associated with arbitrator claims, the agency would have to continue to collect and then revert the funds to the general fund at the end of the fiscal year. Accordingly, if the arbitration charge revenue is deposited to the general fund, then the general fund appropriations would be needed to support a portion of the ongoing personnel costs in this budget. So the subcommittee could consider recommending that a committee bill draft request be introduced to authorize the agency to retain revenue collected to recover costs associated with certain arbitrator claims and reduce the level of general fund needed in this budget. I would also note that included in the governor's recommended budget is a supplemental appropriation. There's some information provided on that supplemental appropriation on page 17 of your closing packet. As recommended, the supplemental appropriation is just under $32,000. However, based on updated projections, that supplemental appropriation may need to be increased to approximately $183,000 for fiscal year 2023. I note that for the committee, as if a recommendation is made to have legislation drafted to allow the agency to retain these arbitration charge revenues in its budget, the legislation could be drafted in a manner that would provide transitory language allowing the agency to collect fiscal year 2023 revenues and may reduce or eliminate the need for that supplemental appropriation. So at the top of page 16 of your closing packet, there are two options for consideration by the subcommittee. The first, and I'll read through these here in a second. The first option is to approve the general fund appropriation recommended by the governor and to offset the removal of the interagency or interdepartmental transfers. Option B would be to recommend a bill draft request, as I just discussed, allowing the agency to retain those arbitration charge revenues and would reduce the amount of general fund otherwise needed or recommended for the upcoming biennium. And the amounts that I'm about to read in option B are based on that annualization of the FY23 collections to date of about $182,000 per year. So the decisions for the subcommittee may wish to consider one of the following options. Option A is to recommend approval of general fund appropriations of $449,065 over the 2023-25 biennium to replace revenue previously transferred from the Silver State Health Insurance Exchange, Division of Public and Behavioral Health, Health Care Facilities, and Division of Public and Behavioral Health Prevention and Treatment budgets to support a portion of ongoing Office of Consumer Health Assistance personnel and associated operating costs. Or option B would be to recommend approval of arbitration charge revenue of $364,232 and general fund appropriations of $84,833 over the 2023-25 biennium to replace revenue previously transferred from the Silver State Health Insurance Exchange, Division of Public and Behavioral Health, Health Care Facilities, Division of Public and Behavioral Health Prevention and Treatment budgets to support a portion of the ongoing Office of Consumer Health Assistance personnel and associated operating costs in the upcoming biennium, contingent on enabling legislation to retain arbitration charge revenue in the budget. If this option is recommended, the subcommittee should also recommend that enabling legislation be drafted to facilitate the recommendation to authorize the agency to retain revenue collected in fiscal year 2023 and going forward to recover costs associated with certain arbitrator claims.
And I believe we have some questions. I'll start with Senator Titus.
Thank you, Madam Chair. So just for clarification, the Office of Consumer Health Assistance, one of their main charges was to stand up and function and run the 211 program. They're still doing that, correct?
No, that office is not doing that. Maybe
No.
best to.
Do we have someone from the agency that might be able to come
does
up and
the
answer some of those
211 program?
questions? Thank you.
Dina Schmidt for the record. Thank you for the question. So 211 is operated under Aging and Disability Services, but not specific to the Office of Consumer Health
All right,
Assistance.
so thank you for the clarification. So the next question I have is, with this unintended, not uncommonly, we see unintended consequences to some of the legislation that we pass, and one of those that happened last session, or it was 2019, it was all about surprise billing, and then if you disagreed with the bill, you could go to arbitration. So the arbitration that you're doing is between the insurance company and the provider, not the consumer, correct?
Dina Schmidt for the record. That's correct.
So just how did your office assume that responsibility then, this particular sub-office?
Dina Schmidt for the record. So the statute assigned the responsibility
To arbitration
the
to
Office
you.
of Consumer Health Assistance.
All right, and so who pays the fee? Are you collecting, if somebody goes to arbitration, so these fees are collected from both the insurance companies and the providers, or how does that get decided?
Dina Schmidt for the record. So the statute outlines the process, and it requires the person that loses to pay.
All right, and so at this time, as you mentioned in your statement, you're only seeing this escalate. There's been more arbitration going forward?
Dina Schmidt for the record. That is correct.
Okay. Those were my questions. Thank you very much.
Ms. Schmidt, can I ask you another question to follow up on this? This just went into effect. So this was the first fiscal year that we've actually seen this. So we don't really have an idea if there's an increase because we only have this 1 year to compare to. Is that my understanding? Is that correct?
Dina Schmidt for the record. So it did go into effect after last session. And yes, it's been, in the last 2 years, we've seen an ebb and flow, and I think we've given the caseload projections related to arbitration. So they do tend to come in waves. But it's been a steady increase, but then there's times where it'll drop off and then it'll increase again. So yes, there's been quite a bit of volatility with the number of arbitrations received.
So it's fair to say that because this is so new, we're still trying to get an idea of what this might look like going on in the future.
Dina Schmidt, for the record, I would say yes. And then just to keep in mind for the committee's consideration is that there's national legislation going through that makes changes to this same process as well that we haven't seen a direct impact yet, but we just don't know as that plays out if that will have a direct impact on our processes.
I think we have a further question from Senator Severs-Gansert.
Thank you, Madam Chair. So when you do the arbitration, I have a couple questions. How do you bill it? Do you bill per hour, or how do you figure out, what to charge back?
Dina Schmidt, for the record. So we do time track each individual that works on the arbitration process, and so then we came up with an average amount of time for all arbitrations, and we bill according to the average amount of time it takes to do an arbitration.
And then is that $1 per hour, or?
We have a set dollar per hour. I apologize, I don't have that number with me, but we established a set rate, that we do charge.
Thank you. Would you mind following up with that?
Absolutely.
And also, do you know what your average time is for arbitration?
I apologize, I don't have it with me.
Okay.
Oh, wait, maybe I do. Hold on one sec. I know we. Dina Schmidt, for the record. So I know that we had, 63% of our staff time are spent on main program activities, about 17% of the time, but I don't have the actual rate that we charge, but I will follow up with you.
Thank you. I appreciate that. And then just sort of a comment. It seems like we went the other way with court fees. I know we're looking at A or B, but court, we put everything into general fund. Oh, no, we put all the assessments into general fund like this, and then we went with general fund, right? Versus this, we're looking at using the assessments and then making up the difference with general fund, just the opposite?
We have that bill. We haven't even heard it yet, so I'm sure that is part of the discussion that we'll have on whether or not our policy as a state in whole should be on fines and fees.
Chair, if I may,
Go
I did
ahead.
not realize one of my staff, I apologize, I forgot, she's in Las Vegas and she can answer Senator Gansert's question.
Oh, wonderful.
If you don't mind.
I'll go ahead. I'll just
Thank you.
remind her to state her name for the record.
Thank you. Carrie Embry for the record. So the time on arbitrations is about 20% of staff time, and the hourly rate is $135 an hour based on that time.
Thank you. And just to follow up, and then how much time do you typically spend on a case? What's the average time?
The time varies, but it averages out. It's about 20% of about 4 hours or so.
Thank you.
Do we have any other further questions or comments? Go ahead. Go ahead, Senator Titus.
Thank you. I apologize. So I guess what I was looking for an answer is, from the time somebody applies for arbitration, does it take them 2 weeks to get it done? Does it take 6 months? Because we worry about payment then to the provider and the delay in payments. And so if they go to arbitration, are they looking at a year before it gets settled, or 2 years? I know it's a new program, but how quickly are you able to settle this? Whether it takes 4 hours or how many hours, how quickly can you get it done?
Carrie Embry for the record. It takes approximately 96 days from the time an application is received through the determination process. Business days, excuse me.
There we go. Thank you. Any other further questions? No. Seeing none, I would accept a motion to recommend option B, which is the approval of arbitration charge revenue of $364,232 and general fund appropriations of $84,833 over the 23-25 biennium to replace revenue previously transferred from the Silver State Health Insurance Exchange, DPBH Healthcare Facilities, DPBH Behavioral Health Prevention and Treatment budgets to support a portion of ongoing OSHA personnel and associated operating costs in the upcoming biennium, contingent on enabling legislation to retain arbitration charge revenue in this budget. If this option is recommended, which I am recommending it, the subcommittee should also recommend that enabling legislation be drafted to facilitate the recommendation to authorize the agency to retain revenue collected in fiscal year 2023 and going forward to recover costs associated with certain arbitrary claims. And I would accept a motion.
So moved.
Second.
Any further discussion on that option? It looks like I have a discussion from Senator Severs-Gansert.
Thank you, Madam Chair. And so, I think we should be consistent, and this is a growing program, and I have a feeling that this is going to get bigger versus smaller as people recognize they have the ability to arbitrate. So I think that we should make sure that we've got the general fund there to support them, and then put the income they receive in the general fund. So like we're looking to do for the courts, or we should be consistent. Thank you.
If I could have staff also clarify, because I think we would be having to use general funds to supplement this no matter what. But I think having this enabling legislation would also allow us to retain those revenue from the fiscal year 2023. And if I could just have staff kind of clarify that, just so we're clear.
Thank you, Madam Chair. For the record, Brody Leiser. The legislation that's recommended under option B would include transitory language that would allow for the revenues to be retained in fiscal year 2023 and possibly reduce or eliminate the need for the supplemental general fund appropriation that's recommended in the budget. If option B is not chosen, then yes, general fund appropriations would be needed to fully fund the budget as recommended by the governor. I would note just that these particular revenues that we're talking about are associated with direct services being provided by the agency and would be to recover costs for personnel performing those services in this budget. The statutes that allow for the arbitration services don't specify that the Office of Consumer Health Assistance is the only agency that could do arbitration. And so if additional agencies at some point did perform arbitration, the legislation would also be drafted in a manner that would allow any other agencies in the future that performed these specific services and charged for these services to retain the revenues associated with the services to recoup costs in the budget for those services.
Do you have any follow-ups?
Thank you, Madam Chair. I just want to make sure that we are able to provide these services as are required in statute. And I'm continue to be concerned that we make sure that we've got the funding there. And it is interesting that entities, agencies other than this agency maybe would perform the arbitration. I'm not quite sure how, what that opens us up to. But so anyway, for now, I'll oppose because it is new, and I feel like it's inconsistent with how we've looked at some other, even though the legislation hasn't passed, but how we've looked at other funded or situations like this. Thank you.
And I think staff wanted to follow up. Go ahead.
Thank you, Madam Chair. Again, for the record, Brody Leiser. I should have indicated this in my comments as well, because the concern with ensuring that the budget has sufficient resources to carry out its duties. There would be and still general fund appropriations included in the budget. So if the projected non-general fund revenues don't come in at the levels that are budgeted and the agency had a shortfall, they would have access to the IFC contingency account to receive an allocation from that account if a shortfall did exist. So I should have mentioned that earlier and just want to make sure that that's clear as well.
Go ahead.
Thank you, Madam Thank you, Madam Chair. And again, I appreciate some of the comments that were brought up around consistency. But again, when I look at other agencies that do that provide services or that do kind of investigatory work, they do have a form of time and effort billing that is meant to cover the costs of the agency conducting that work. And so I actually do see the ability to retain these funds, the charges that are being put forward to conduct this work, being consistent with other agencies, and do see that a little bit differently than some of the conversations that we've had about overall kind of court assessments and general fines that have been divvied up among different agencies. So I'm in support of the proposed motion.
I'm sorry.
1 minute recess.
1 minute recess.
You guys. Okay, thank you for that brief recess. We just had to confer a little bit of procedural stuff here. At this time, I actually would accept a motion to rescind the previous motion and second made on this decision unit.
So moved.
Second.
Any questions on that rescinding motion? Just rescind, is it? Okay, then I won't take a vote on that. So that motion is rescinded. I would make a motion I don't know if I have to make a motion to defer it. Do I? You don't have to. Okay, I'm going to make the motion just to make it very clear. I would accept a motion to defer this decision unit to the full committee so we can get some additional information on this.
So moved.
Any further discussion on that? All those in favor say aye. Aye. Anyone opposed say nay. The motion carries, and we will move on to the next item.
Thank you, Madam Chair. For the record, Brody Leiser. The second major closing issue is on page 16. It relates to case management system improvements. The governor recommends general fund appropriations of $162,000 over the biennium to fund improvements to the OCHA case management system. These system improvements are needed to meet new statutory reporting requirements from Assembly Bill 469 of the 2019 legislative session, and which requires the agency to conduct and report annually regarding arbitration services. The funding would include system configuration and report updates to allow for the automation and more effective case management workflows, data capture, and reporting capabilities. The agency did indicate that IT staff would provide ongoing maintenance and support for the system and implement future enhancements in-house beyond the upcoming biennium. The decision point is at the top of page 17. Does the subcommittee wish to recommend approval of general fund appropriations of $81,000 in each year of the 2023 to 25 biennium as recommended by the governor to fund one-time costs for improvements to the Office of Consumer Health Assistance case management system?
I'd entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. There are 5 other closing items on page 17 of the closing packet. Fiscal staff recommends all other closing items be closed as recommended by the governor, with other closing item 5 contingent upon future action of the subcommittee to recommend the approval of and transfers in the new planning, advocacy, and community grants budget, and request authority to make technical adjustments as necessary.
Any questions? Seeing none, I'd accept a motion.
So moved.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries. We'll move on to the next one.
Kathy Crockett, Fiscal Analysis Division. The next budget is the Early Intervention Services budget, beginning on page 19 of the packet. There are 4 major closing issues in this budget. The first issue is caseload adjustment. The governor recommends a net decrease in funding of approximately $141,000 over the upcoming biennium to fund projected caseload changes and associated staffing adjustment for the Early Intervention Services program. Moving on to page 20, the agency provided updated caseload projections calculated in March, consistent with other Department of Health and Human Services programs. The monthly average caseload is projected to increase from 3,593 children in 2023 to 3,787 children in fiscal year 2025, representing an increase of 5.4% over the biennium. The updated caseload projections, which are shown in a table on page 20, are slightly higher in each year of the upcoming biennium than recommended in the executive budget. Service costs associated with the caseload changes based on the updated projections are $1.5 million in fiscal year 2024 and $1.7 million in fiscal year 2025. There are also associated staffing adjustments. The updated caseload projections and associated staffing ratios drive the elimination of 11 vacant positions, including 7 developmental specialist caseworker positions and 4 developmental specialist for supervisor positions. Staffing costs associated with these adjustments decrease by $2 million over the biennium. There is a table on page 21 that summarizes funding recommended by the governor and the funding based on the updated caseload projections. The total funding for the updated caseload projections is $1.2 million over the biennium. Fiscal staff would note that last week the agency received notice from a community provider in Southern Nevada that it will be terminating services within 30 days. The provider's current caseload of 218 children would need to be placed with other service providers. While there is some capacity in the community provider network, the agency estimates approximately 100 children may need to be placed on the state clinic caseload to ensure continuity of services. With the existing approved staffing ratio, a caseload of 100 additional children requires approximately 5 caseworkers. Currently, the agency has 18 vacant caseworker positions. Given the staffing vacancies, the agency and the governor's finance office agreed that no staffing adjustments are necessary at this time. If the agency does fill existing caseworker positions and is unable to manage the caseload, then the governor's finance office indicates it will work with the agency to propose a solution during the interim, which may include a work program request to the interim finance committee or a contingency account request. The decision for the subcommittee is on page 22. Does the subcommittee wish to recommend approval of net funding of $552,655, including $619,069 in general fund appropriations in fiscal year 2024, and $694,477, including $744,749 in general fund in fiscal year 2025 to support early intervention services caseload changes, including the elimination of 11 vacant positions over the biennium in the M200 and M201 decision units based on the March 2023 caseload projections.
Do we have any questions or comments? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries.
The next issue is service model change. The governor recommends combining the early intervention services caseload service cost categories to eliminate the 50-50 split service model between state and community providers. This is a revenue neutral change to the current service model to allow for flexibility in parent choice in selecting service providers. The cost per child differs between the state and community providers. Currently, the program pays community providers a monthly capitated rate of $565 per child served, and the monthly cost per child receiving services through the state clinics is approximately $270 with additional overhead costs for personnel and operating. The caseload may continue to shift to more children receiving services from community providers. Therefore, due to the potential shift amongst the provider service models, the long-term costs of this recommendation are unknown. This program has operated under the split service delivery model since 2013, when the legislature approved the program to split the caseload equally between the state and community providers to transition more caseload from the state clinic to community providers. The state would continue to support the needs of rural and medically fragile children, and the agency does not anticipate any significant changes to the current program, including roles, responsibilities, and oversight. The agency indicated during the budget hearing that the program is challenged now with fitting the caseload under the 50-50 split, and it expects the elimination of the split to improve efficiency of the overall system, to ensure service needs are met, and support more timely services. Additionally, it would allow the program to see what the true need is regarding parent choice in providers. Due to uncertainty of future caseload shifts and the current staffing shortages affecting the timely delivery of services, the subcommittee may wish to recommend a letter of intent be issued to the agency to report on a semi-annual basis to the interim finance committee in the upcoming biennium on the status of the program, including the number of children receiving services from the state clinic and community providers, the costs incurred by each caseload, the cost per child served, projected caseload, state clinic staffing needs, and the agency's and community providers' ability to meet timeline and service needs. Does the subcommittee wish to recommend approval of the governor's recommendation to combine the state clinic and community providers' caseload service cost categories into a single category to eliminate the required 50-50 split service delivery model, and to recommend issuing a letter of intent to the agency to report on a semi-annual basis to the interim finance committee during the upcoming biennium on the status of the early intervention services program?
Do you have any questions or comments? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Those opposed say nay. Motion carries. Next item.
The next item is a community provider rate increase. The governor recommends general funds of approximately $10.4 million over the biennium to increase the rate paid to early intervention services community providers. This would be a 40.7% increase in the monthly rate paid to providers from $565 to $794.88. This is based on the results of a study of provider payments for service providers and has recommended the total cost of child served. The agency indicates the recommended rate reflects the total revenue needed to cover provider costs regardless of payer, which is a change from the current practice wherein providers receive a monthly per child payment from the program and retain any payments also received from private insurance or Medicaid. The program also receives funding from the federal Individuals with Disabilities Education Act Part C grant, which does require a maintenance of effort. So just as the subcommittee is aware, all general fund appropriations added to this budget and expended must be continued in successive fiscal years for the state to remain in compliance with that grant. During the budget hearing, the payment mechanism was discussed, whereby the comprehensive monthly rate paid per child is adjusted to account for any payments received from other payers. And this is, the agency indicated this is currently laid out in the existing provider agreements, but has not previously been implemented due to lack of data. There was a caseload adjustment applied to this decision unit, and the costs are slightly less compared to the executive budget. Does the subcommittee wish to recommend approval of the governor's recommendation of general fund appropriations of $5.1 million in each year of the upcoming biennium for an increase in the rate paid to early intervention services community providers from $565 to $794.88 per child per month based on the updated March caseload projections.
Thank you. Any questions or comments? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries, and I am actually going to turn this gavel back over to Chair Gorlow. I have to go present a bill, but have fun.
Kathy Crockett, Fiscal Analysis Division. The next major closing issue is the state clinic cost per child adjustment. The governor recommends general fund appropriations of approximately $977,000 over the upcoming biennium to adjust the cost per child receiving services through the state clinic. This would fund an 8.3% increase in the monthly cost per child served, and it's based on the annual inflation rate for the 12 months ending April 2022, according to the agency. This has also been adjusted for caseload updates, and the updated projections result in a slightly different cost than recommended by the governor. Does the subcommittee wish to recommend approval of general fund appropriations of $504,547 in fiscal year 2024 and $519,801 in fiscal year 2025 to fund the governor's recommendation for an 8.3% increase in the monthly cost per child receiving state clinic provided services as adjusted from $270 to $292.41 per child per month based on the updated March caseload projections.
So moved.
I guess I'm back. All those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
There are 7 other closing items which appear reasonable. Fiscal staff recommends all other closing items be closed as recommended by the governor and requests authority to make further technical adjustments as necessary.
Any questions? Do I have a motion?
So moved.
Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Kathy Crockett, Fiscal Analysis Division. The next budget is the Autism Treatment Assistance Program, beginning on page 29. There are 2 closing issues in this budget. The first relates to caseload adjustments. The governor recommends net funding totaling $2.6 million over the upcoming biennium to fund projected caseload changes and associated staffing adjustments for the Autism Treatment Assistance Program. There's a page on page 30 which displays the governor's recommended caseload and updated caseload projections. The recommendations include adjustments for standard demographic caseload growth as well as decision unit to eliminate the wait list. The monthly average caseload is projected to increase from 995 children monthly average in fiscal year 2023 to 1,237 children in fiscal year 2025, representing an increase of 24.3% over that time period. There are also adjustments to staffing levels based on the projected caseload changes. Decision Unit M201 eliminates 5 vacant Developmental Specialist 3 caseworker positions, as well as 1 filled Developmental Specialist 4 positions. The budget is funded with 5 Developmental Specialist 4 positions, and all 5 of these existing positions are filled. These are supervisory positions. The agency has requested to retain the filled Developmental Specialist 4 position that would otherwise be eliminated based on the projected caseload, and the agency indicates these positions can be difficult to fill due to the level of experience and responsibility with the program. Retaining this supervisor position with the current incumbent would reduce the approved supervisor to caseworker ratio temporarily from 1.7 to 1.6 with the intent to return to the 1.7 ratio in the future as caseload changes continue. Decision Unit M203 adds 4 new Developmental Specialist 3 caseworker positions, and overall the staffing adjustments result in a net decrease of 1 position over the biennium. The updated caseload service costs and staffing adjustments are shown on page 31. of the closing document with a comparison to the amounts of funding recommended by the governor. The updated caseload projections indicate total funding required of $2.1 million over the biennium. Does the subcommittee wish to recommend approval of net funding of $966,366, $1 million in general fund appropriations, and a $47,746 decrease in federal funds in fiscal year 2024, and $1.2 million total funding, including $1.2 million in general fund appropriations and $18,215 decrease in federal funds in fiscal year 2025 to support projected caseload changes for the autism treatment assistance program, including associated staffing adjustments and the elimination of the wait list over the upcoming biennium in decision units M200, M201, and M203 based on the updated March caseload projections and retaining one caseworker supervisor position that is currently filled.
Any further questions or comments? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Next item.
The next major closing issue is a new psychological development counselor position. The governor recommends funding of $192,416 over the biennium to fund a new position and associated costs to provide clinical oversight and facilitate eligibility determinations. Primary duties of this position would include conducting clinical level diagnostic assessments and adaptive testing for eligibility purposes, reviewing eligibility criteria, and reviewing intake cases and verifying eligibility determinations. The agency indicated at the budget hearing that the wait time for children to begin receiving services for autism is critical, and lengthy wait times can impact a child's development, and the agency believes that this additional position would help potentially get children to services more quickly. Does the subcommittee wish to recommend approval of $192,416, including $157,831 in general fund appropriations over the upcoming biennium to fund one psychological development counselor position and associated costs?
Any questions? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
There are three other closing items which appear reasonable. Fiscal staff recommends all other closing items be closed as recommended by the governor and requests authority to make further technical adjustments as necessary.
Any further questions? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
The next budget is the Focus and MFP budget. That is the Facility Outreach and Community Integration Services and Money Follows the Person programs. The executive budget recommends a new standalone budget within the Aging and Disability Services Division for these existing programs. And this would be facilitated through a transfer from the Division of Healthcare Financing and Policy, including 13 existing positions, and funding of $3.6 million in fiscal year 2024 and $1.9 million in fiscal year 2025. There is a table on page 36 of the document that goes over the decision units and associated funding to facilitate the creation of this budget account. During the budget hearing, the agency discussed how the work of its division aligns with the objectives of the Facility Outreach, Community Integration Services, and Money Follows the Person programs to support individuals in achieving their goals and transitioning from institutional care to the community settings. And they indicate their agency is better suited to coordinate with other programs to help individuals transition to the community. Does the subcommittee wish to recommend approval of the transfer of the Facility Outreach and Community Integration Services and Money Follows the Person programs from the Division of Healthcare Financing and Policy to the Aging and Disability Services Division in a new standalone budget as recommended by the governor, with authority for fiscal staff to make further technical adjustments as necessary?
Any further questions? Seeing none, entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Kathy Crockett, Fiscal Analysis Division. That concludes the budgets that were heard by the subcommittee. Moving on to the budgets for which staff has recommended closing options. The first budget is commission for persons who are deaf on page 39. There are no decision units in this budget. The second staff closed budget is the tobacco settlement program. There are 2 other clothing items which appear reasonable. The third staff closed budget is the communication access services budget, and there are 5 other closing items which appear reasonable. The final budget is the applied behavior analysis budget, and there are no decision units within this budget. As previously discussed, fiscal staff is responsible for developing recommendations for the budgets to be noted to assist with the closing. Fiscal staff has identified budgets that are recommended to be closed as recommended by the governor, and fiscal staff requests these budgets be closed as recommended by the governor with authority for staff to make technical adjustments as necessary. That's budget 101, 1006, Commission for Persons Who Are Deaf, 101, 3140, Tobacco Settlement Program, 101, 3206, Communication Access Services, 101, 3207, Applied Behavior Analysis.
Do we have any questions regarding those 4 budget closings? Seeing none, I'd entertain a motion.
So moved.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries, and that brings us to the very end. Very exciting. So I will close that agenda item. We have one last thing, and that is public comment. I'd ask people to come up to the front table, either in Las Vegas or here in Carson City, and remind you that you have 2 minutes for public comment. I don't see anyone coming to the table, so broadcast services, can we see if there's anyone on the line to provide public comment? And I remind people watching online that the information on how to, there are people coming up. Never mind. I'm going to come back here in person, but I'm going to finish up that statement, so that might give people time to get on the phones if they wish to testify in public comment on the phone. That information and that telephone number and meeting ID is located on the agenda, which is located on Nellis. And again, go ahead, please state your name for the record, spell it for the record, and again, you have 2 minutes. Go ahead.
Harold Mark McBride, for the record. Hi, Madam Chair Wen, Madam Chair Grollo, and other subcommittees. My name is Harold Mark McBride. I'm the campus administrator at Highland Village of Fallon in Fallon, Nevada. We are a nonprofit campus. We serve the underserved population in rural Nevada. Our services are skilled nursing, assisted living, and independent living. I'm asking for your support for additional Medicaid funding for our nursing homes. The financial and workforce challenges have been primarily impactful in our communities. We do everything we can to provide quality health care. We have found ourselves in a situation when in many cases, month to month, we're out of pocket for expenses to provide this care. And with increased labor, rent, food, utilities, they have significantly impacted our operations, especially in the wake of the pandemic. Nevada's current Medicaid reimbursement rate have not matched up to the cost for quite some time, as you might be aware. Unfortunately, we've only had 2 Medicaid increases in the last 20 years. In particular, staffing challenges were an unfortunate reality even before the pandemic. They worsened as our elderly population increases, particularly in skilled nursing. We support roughly 115 direct care and non-direct care staff, which is a mix of W-2 employees and costly agency staff. With fewer agency staff in the workforce, fewer trained caregivers, we are forced to make up the difference, being a 24/7 operation, to staff and provide the needed care that's required. That might be from staff that we've lost that have not returned back to the workforce, that might be on sick leave. For whatever reason there might be, we need to make up that difference. Our rural and underserved communities, again, they're really the most vulnerable populations, as you know. to provide adequate funding, it's imperative that we receive this so that we can keep our doors open in many cases. Without that, other facilities, not just in Nevada but throughout the nation, have faced closure. We're seeing that in state after state. And we want to be leading the charge in providing the highest quality care, not just for Nevada but nationwide. Committee members, I do ask that, and acknowledge that this is a crisis indeed. Thousands of our seniors are counting on you to help fix this situation. An additional rate increase on top of the 5% the governor recommended budget is not only needed but necessary. And I respectfully ask you to approve this funding. Thank you.
Chairs Gorlo and Wynn and members of the subcommittees, my name is Marie Costanadora, spelled as Marie Costanadora. I am the Vice President of Clinical Services for Revive Health Senior Care and a board member of Philippine Nurses Association of Nevada. Revive manages 3 nursing homes with approximately 373 residents in northern Nevada. I'm here today to request to approve additional Medicaid rate increase to help Nevada seniors. The cost of supplies and services have doubled or even tripled since the pandemic. Nevada's chronically low Medicaid reimbursement rates have not kept up with this cost. As you know, staffing shortages are also a challenge. Fortunately, our facilities does not use agencies. We offset this by allowing large amounts of overtime, but this can cause burnout to our caregivers. Offering competitive salaries and benefits are the primary ways to recruit new caregivers. But this only adds to our overinflated operating costs, and the Nevada low Medicaid reimbursement rates put us further on a financial brink. This particular industry takes care of lives. It can be your mother, your father, other families, or friends. It is not like retail where we can shut down the doors when there is not enough staff. Care must go on. As at this pace, nursing homes could start closing their doors and leave Nevada seniors without the care they need. We appreciate the proposed 5% increase in the governor's budget, but additional funding is essential. Nevada seniors and caregivers are struggling, and we need your help. I respectfully ask that you increase the Medicaid reimbursement rate for nursing homes. Thank you.
Thank you. Broadcast services, can we go online for public comment?
We have no callers in the queue for public comment at this time.
Thank you. And at this time, I will close public comment. I will thank everyone for their patience today and have a wonderful Friday and weekend. Take care. And the meeting is adjourned.